Okay. Okay, so for the clinical portfolio, you will find this information now under this week, starting the 3rd of March. And there is a dedicated Moodle book for that. And there's also an introduction PowerPoint presentation about the clinical portfolio. So for all of the clinical portfolios, you need to gather 25 clinical cases and make sure that you include normal cases as well. Students are so focused on identifying pathology that sometimes they totally ignore picking up on the normal cases, which is a very important skill as well. And then so that's one part of it, is to write up 25 clinical cases. And then the second part is about the self-auditing preliminary image evaluation. And I will talk about that a little bit later as well. So the portfolios submitted in the final week of the formal university's exam period. So for RAD5109, that is on Wednesday, the 25th. But I would encourage you to start with that as soon as possible. So your clinical cases equals 100 marks. Each case is worth 4 marks. And the overall word count is 2,000. So each case is about 80 words, but don't stress too much about those 80 words. And then, of course, for this unit, you need to focus on the pelvis, the lower limb, thoracic, and lumbar spine. And please don't forget about the normal cases as well. And you need to include things like either the mechanism of injury or if there's any clinical signs and symptoms. You have to include at least one de-identified image. You can include more than that, of course. And then write up a preliminary image evaluation. And do that without looking at the radiologist's report. And once you've written your PIE, then only go and compare that to the radiologist's reports. You can include things like immediate patient management, but that is not a requirement. And you can also include references to support your discussion, but again, that is not essential. This is the marking rubric then for each case. So I'm looking for, do you have any of the presenting symptoms? You can apply the ABC search strategy to your radiographic appearances. You don't have to address each of the ABC. So if there is an abnormality that only includes, say, the bone and not the joint, then you need to just focus on what the bone and alignment would probably also be one that you will be focusing on. And then to compare your report to that of the radiologist. And to remember, you need to answer the clinical question. So if the radiologist adds other detail that's not pertinent to the clinical question, you don't have to mark yourself against that, especially if they include for example, osteoarthritic changes or things like that. And then, as mentioned, at least one de-identified image. Now, here's an example of how you can write up your clinical case. Make sure that you number each case, identify the region that you're talking about. And if you have a case, say, for example, you have an ankle, but there was also, say, a lower limb x-rays, write it up as 2 separate cases. It's much more easier for the students to do it in that way. And then include your clinical indications. I've mentioned about the image that must be included. So just as an example here, there was a Salter-Harris 4 fracture of the left medial malleolus. There's an anterior teardrop sign, which indicates joint effusion. There's significant soft tissue swelling. So that is what the student wrote. But when compared to the radiologist, it was mainly consistent. However, the radiologist identified as a Salter-Harris type 3 and not a Salter-Harris type 4. So when you then do your true positive and true negative, things like that, the true positive then was 0.67 and the false positive was for the incorrect classification, and that's 0.33. Remember, when you add everything up, it must be equal to 1 for each of the cases. In your second part, the self-auditing PIE record, you'll have a table then of your 25 cases, and also according to your body regions. You don't have to have all following, so you could, some students try to be very systematic. They'll have all the ankles together, but it's not really necessary to do that. We do check, though, that you have covered the body regions. And as mentioned, make sure that you also have normal cases with your abnormal. Now, I've already talked about the PIE report. So when you assign, where there's true positive or true negative, you need to assign it for each case and write it at the bottom of that case in your case report as well. And so you might need to assign fractions as mentioned. So for example, if there's two fractions, you've only identified one, it means you've only identified half of that. So half will be true positive and the other half will be a false negative for missing the other pathology. And then you need to calculate your sensitivity, specificity, and accuracy, and then provide a brief reflection on your image interpretation abilities as well. And this is just how you assign your fractions and so on. So this is what the table would look like. So you will, of course, add more rows to that. So remember, if it's the thoracic spine, when you add any of these fractions in across a case, it must only be equal to 1. So if you had 25 cases, you had a total of 25. When you add all of this up, your false negative, false positive, true negative, and true positive, this row here must also be equal to 25. This is the 2x2 table, and the PIE report is checked against the radiologist report, which is called the gold standard as well. So sensitivity is your ability to pick up abnormalities, and you would like to get it as close as possible to 100%, which means you would ideally there should be few false negatives. With specificity, again, try to get it as close as possible, and that is your ability to exclude any abnormalities, that is to identify the case as normal. So you would like to have a few false positives. So accuracy is the overall ratio. Basically, it's the true positive and true negative. So it gives an overall ratio of how well you are in identifying both abnormalities and normal cases. So yeah, so in summary, start collecting your clinical cases and then ensure that you include normals as well. If you have any issues with collecting clinical cases, please feel free to contact either myself or Tony, or both of us. So if there's any issues that we struggle how to write it up as well, you can always contact us because we're here to assist you. Okay, thank you.